Hello everyone. Welcome to my channel. By Sejal Patel.
Today's topic is types of tablets in pharmaceuticals. There are 8 types of tablets listed below. 1. Core tablets are uncoated tablets. 2. Coated tablets. A. Film-coated tablets. B. Sugar-coated tablets. 3. Enteric-coated tablets. 4. Dispersible tablets. 5. Modified release tablet. 6. Prolonged release tablets. 7. Effervescent tablets. 8. Lozenges and sublingual tablet. 1. Core tablets are uncoated tablets. These are compressed tablets, maybe a single or double layer. These tablets are designed to provide rapid disintegration in the gastric fluid of the stomach. Uncoated tablets are formed by compression of active pharmaceuticals with excipients like bulking agents, disintegrates, binders, lubricants, and some coloring and sweetening agents. These help tablets withstand during manufacturing, storage, and use. The addition of coloring and flavoring agents to uncoated tablets, other than multilayer tablets, is not official unless permitted in the individual monogram of official books and pharmacopoeias. Examples of compressed tablets for oral, buccal, sublingual, or vaginal administration. Paracetamol 500 mg and clotrimazole tablets, for vaginal insertion.
2. Coated tablets. Coated tablets are categorized into 2 types, A. Film-coated tablets, and B. Sugar-coated tablets. A. Film-coated tablets. These are tablets coated or sprayed with a thin layer of polymers, hydroxypropyl methylcellulose and hydroxypropyl cellulose, or a mixture of polymers, example, Eudragit E100, which are responsible for forming a thin layer of film on compressed tablets. The thickness of such coating is usually between 20 to 100 mm. The coated tablet is designed to break to expose the core tablets at a desirable location in the gastrointestinal tract. Examples of film-coated tablets are erythromycin, amitriptyline, diclofenac potassium USP 100 mg, and valsartan 320 mg film-coated tablets. B. Sugar-coated tablets. The sugar solution used with other additives for coating is called sugar coating. It has the following steps. Sealing of tablet core. Sealing of tablets is done by using polymers such as shellac, cellulose acetate phthalate, and polyvinyl acetate phthalate. They protect the core of tablets from moisture. Subcoating. Subcoating of tablets is done by adding a bulking agent, example, calcium carbonate or talc, in combination with sucrose solution. Smoothing. Use sucrose syrup to remove the dull surface formed in step 2 stages. Coloring. For coloring tablets, use titanium-based pigments. Polishing. For the polishing of tablets, commonly, beeswax or carnauba wax is used. Printing. Indelible ink is used for printing on sugar-coated tablets. 3. Enteric-coated tablets. Enteric-coated tablets are covered with 1 or more layers of the coating solution. The purpose of an enteric coating is to provide resistance to the gastric fluid in the stomach. Finally, drugs release their active ingredients in the intestinal fluid. These types of coating are aimed to prevent the formulation from gastric fluid or gastric acid in the stomach. So enteric coating helps drugs release the component directly inside the intestinal region. Polymers like CAP, cellulose acetate phthalate, and hydroxypropyl methylcellulose succinate, which is insoluble at low pH, but soluble at high pH. An example of enteric-coated tablets is diclofenac sodium delay release 100 mg tablets. 4. Dispersible tablets. Dispersible tablets are uncoated tablets that produce a uniform dispersion in water and may contain permitted coloring and flavoring agents. 5. Modified release tablets. These kinds of medications give immediate dose necessities for traditional therapeutic responses, followed by a gradual release of drugs in an amount sufficient to maintain the therapeutic response for specific extended periods of time, usually 8 to 12 hours. 6. Prolonged release tablets. Prolonged release tablets are also called sustained release tablets and extended release tablets. These are designed to release their medication in a predetermining manner over a prolonged time period. Examples of prolonged release tablets are divalproic sodium extended release tablets. 7. Effervescent tablets. Effervescent tablets release carbon dioxide after mixing with water because it contains acidic substances like carbonate or bicarbonates and act as a disintegrator which either produced a drug suspension or an aqueous solution. 8. Lozenges and sublingual tablets. Lozenges and sublingual tablets are used in the mouth, and lozenges and sublingual tablets are usually uncoated and formulated to chewed or to effect a slow release and local action of active ingredients. Lozenges, or the release and absorption of active ingredients under the tongue, sublingual tablets. An example of lozenges and sublingual tablets is nitroglycerin tablets for angina pectoris. I hope you find the information useful. I would appreciate your likes, shares and subscribe.